The Ontario government says this year's seasonal flu shot program will be the largest in the province's history. Vulnerable people will be prioritized and the general population will become eligible in November. But as Matt Ingram reports, the rollout stirred up a bit of controversy today.
A family doctor in Ottawa says she had to postpone giving out 500 flu shots by 2 weeks, claiming it was so Shoppers Drug Mart can give them out first. But the province says claims that doctors are receiving a limited supply of flu shots because many of their doses are going to pharmacies are not accurate. The Ministry of Health says it gets smaller quantities from the feds and manufacturers to start, so it's prioritizing vulnerable people beginning this month. The province says hospital patients and staff are top priority, people at high risk of flu-related complications are next, and the general public become eligible in November. Based on demand, Ontario will send 40% of the total supply to pharmacies.
Pharmacists are one of the most accessible healthcare professionals. We see thousands of patients every day.
Local pharmacist Phil Hauser says pharmacists gave out more than half of all flu shots last year, so sending the shots to them makes sense. Loblaw Companies, which owns Shoppers Drug Mart, tells CHCH News its pharmacies have begun to receive flu vaccine and have started offering them to eligible high-risk patients via walk-in, including at locations in Hamilton and Niagara. Hauser says you can get your flu shot and COVID vaccine at the same time.
There does not necessarily need to be any spacing in between.
Hamilton Health Sciences says it will begin offering patients the shot this week, with doctors and staff following a week later. Niagara Health, which operates hospitals in Niagara, say it will start giving out flu shots on Thursday. Niagara Region Public Health says it has begun shipping flu vaccine to primary care doctors, with initial doses reserved for long-term care residents and vulnerable elderly and immunocompromised people. Acting Medical Officer of Health Dr. Mustafa Hirji expects to have enough in Niagara by the end of the month so anyone in the public can get a shot. He says it's even more important to get a seasonal flu shot this year. With flu having not circulated last year, people who were unvaccinated last year didn't get influenza, and so their immunity may have weakened more than usual. They will be at a greater risk of severe illness this year. We asked Hamilton Public Health about its flu shot program, but it didn't provide answers by our deadline. Matt Ingram, CHCH News.